1, 2, 3.
For me, as a UK citizen, outside of the COVID-19 problem, the social larger problem is watching and seeing what it looks like when a country with no nationalised health system has to face up to a public health issue such as this. What would it be like here in the UK? Is it even possible to go back to a time that we can imagine what the UK would be like if it didn't have the NHS? Can we imagine, can we model? I'm sure we can model, but can we as regular people imagine what it would be like if we had a privatised system? I don't think that we can, as regular people, imagine what that's like. But I think that this is going to give us a very clear idea of how awful it could be if we didn't have the service that is the NHS. So let's look at that. But first, let's look at a country that has no nationalised health service. After the Ebola crisis in 2014, the Obama White House established the Global Health Security Team within the NSC, the National Security Council. This was to provide a centralised position that could coordinate all the arms of government needed to deal with a pandemic such as we're experiencing at this moment in time with COVID-19. This is not nationalised healthcare, but it shows what the benefits of nationalised healthcare could be for a country that doesn't have any. It allows for focused decision making. It can react quickly to problems, taking actions as appropriate and instantly if needed. The consideration for financial gain is removed. The for-profit model that is currently engaged in the US and has always been engaged in the US is removed completely. It allows health professionals to make the best recommendations without the uncertainty that their expertise will be overruled on the grounds of not giving the right return on investment or some other non sequitur that some political wonk thinks is the right thing at that time. The US, as the world's primary supporter of capitalism and a free market, is reliant on the largesse of private companies and corporations during public health crises. That is putting its people at risk. Trump addressed the people to tell them he'd negotiated with health insurance companies to waive the cost for coronavirus treatment. He was wrong, or lying, possibly both. Insurance companies had only agreed to waive the cost for testing of coronavirus. It also transpired that there are no industry-wide plans to waive costs for hospital stays or any other treatment for that matter. This information came from a major health insurance lobbying group, not from a government official. It's no surprise, but imagine that. A private company informing an entire people what treatment they will receive during a pandemic that's claiming lives. It sounds like fiction, a sort of Logan's Run type story. Well, that one's for the more mature ones amongst us, or perhaps Hunger Games for the younger members of the audience. Actually, perhaps Hunger Games is more analogous, as that really is about survival of the fittest and the system being controlled for the benefit of a tiny minority. Concerns of the cost of testing for individuals gives rise to a major concern that those without insurance, or who are underinsured even, just won't get tested. When people are untested, then it's obvious there will be infected people within that cohort. They will continue with their daily lives, come into contact with others, and they'll infect them. Now, before any right-wing nutjob gets a hold of that, it's understandable why people would avoid being tested if they can't afford to. I mean, obviously for a European to say someone can't get some sort of medical test that's absolutely imperative for them to get, but they wouldn't because they couldn't afford it, is anathema. But it's understandable if we have those that are either not insured or underinsured avoiding testing. Just imagine, even if you're insured, but perhaps underinsured, getting testing, finding out that maybe you're positive and then being treated, that could leave them and their family destitute. The average US citizen does not have enough cash or even access, get this, even access to credit to pay for a $400 emergency. How can they hope to pay for emergency medical care? People forced into this situation have no choice. This leaves people to suffer and perhaps pay the ultimate price, whilst also adding to an already enormous problem. The vast majority of those forced into this obscene, disgusting situation is because they had the bad fortune to not be born into money, or wouldn't pull themselves up by the bootstraps. It's just not good enough, poor people. If you don't have the entrepreneurial spirit and intellect to think ahead, well, then hard lines. So, basically, 6 weeks on from the first cases being reported in the US citizens are being told, thanks to the kindness of their corporate overlords, they'll not have to pay to be tested. Wow. That's, of course, if they can get a test. That's a slightly different issue. However, they will still have the fear that if they need treatment, they will have to find money that they don't have. This test and any treatment needed is for the benefit of the whole community, not just the individual or their family. It can't be stressed enough. This is a whole community issue. There are no individuals in a pandemic. On the specifics of treatment, in Berlin, a pharmaceutical company, CureVac, started work on a vaccine for coronavirus in January. The company's stance is once they, this is a quote, succeed in developing an effective vaccine against the coronavirus, it should reach, protect and help people not only regionally, but in the spirit of solidarity around the world. Now, why am I emphasising this, you may ask? It's uplifting to hear someone, Dietmar Hopp in this case, a major shareholder in the company and billionaire no less, talk about this in terms of the other, people in the outside group. Those that we don't know, but we know need help. And he talks about it in such a human, inclusive way. It's also notable and apposite to this video that Trump approached the company to get exclusive rights to any potential vaccine for the US. Very much in keeping with his me, myself and I approach to everything, with no notion that, once again for the cheap seats, there are no individuals in a pandemic. There are no individual countries. There is only everyone. Hi there. Once again, thanks for watching the video. Now comes the part where I'm going to ask you to help the channel out. If you could hit the like button for this video, comment, let me have your thoughts. Share it with somebody that you think would get value from it. Subscribe so that you get all the future content. However, please remember to click on the bell icon. What would really help the channel out in a tangible way is if you could consider becoming a patron of the channel. If you visit patreon.com/partypoliticalpuffin, just take a look. That would be great. Once again, thanks for your support, and I'll see you in the next one.